Doctors, we are live now. You can start the session.
Okay, thank you. Manisha ma'am, please.
A very good evening to all of you and welcome to the felicitation of the winners for the image competition conducted by VRSI. And today we'll be felicitating all the winners of the months of January, February, and March. I thank the entire team comprising of Dr. Naresh Babu, Dr. Chitranjan Mishra, Dr. Unni Krishnan, and Dr. Sangeet Mittal, who have been making a lot of effort in selecting the images very carefully and recognizing those who have submitted some very interesting images. I would like to welcome Kim Sir, President VRSI, and I will also request Sir to say a few words encouraging the winners.
Thank you, Dr. Manisha. This is one competition that has been consistently happening for quite some time now. And I should again thank the whole team, Naresh, Chittaranjan, Sangeet, and Dr. Unni Krishnan for consistently making sure that the images, and it's not been easy for them. There's been challenges in making people to share their images. So we want more youngsters to participate because this is one way of learning for everyone who's involved in this. There's a lot of learning, as you know, that images are the things that the retina people make decisions on. And we are with all these wonderful new technologies to capture these images. Today we have a sea of images out there. So we want everyone to participate in this. But the team, again, I congratulate the team, which has been working very hard to go through these images and selecting these images on a regular basis. And I also want to congratulate all the winners of this webinar today, where we are going to felicitate all the winners. I congratulate every one of them for being there and participating in this event. Thank you, Manisha. Over to you, Dr. Chittaranjan.
Thank you so much, sir. And before I hand it over to Dr. Chitranjan, I would like to specially thank Dr. Chitranjan because I think this competition has been going on so successfully for last few years, totally because of the tireless effort of Dr. Chitranjan. And it is so encouraging to see the way he pursues all the images which are submitted to VRSI and brings out the best images for all of us to recognize. And it is indeed a treat for all of us to see these beautiful images. So over to you, Dr. Chitranjan, to take the proceedings forward.
Thank you, Dr. Kim sir, for the inspiring words. Thank you, Dr. Manisha madam, Dr. Naresh sir, for giving me the opportunity. Those words are really very big words for me, but I am just doing the work which has to be done for the image committee member. So before announcing the names of the winners, let me introduce the panelists of this evening. So we have Dr. Vasumati Vedantam from Chennai, Dr. Santosh Mahapatra from Cuttack, and Dr. Abhishek Anand from Patna, who are well-known figures nationally and internationally in the field of vitreoretina and retinal imaging. So thank you all three of us, all three panelists to be among us. And now coming to the winners for the month of January, the third prize goes to Dr. Akshat B. Kothari. Dr. Akshat is a fellow alumnus of Sankanetralaya, and he is working in Arvind Hospital, Pondicherry. His areas of interest are retinopathy of prematurity and diabetic eye disease. This is the award-winning image for which he has got the prize, the 3rd of January, titled Bilateral CRAO as a presenting feature of systemic lupus erythematosus in a young female. This is the text Dr. Akshat has shared with us. May I request Dr. Akshat, if he is present in the meeting, to please explain or say a few words about this image. Dr. Akshat, please. I think he is yet to join. In his absence, may I request Dr. Abhishek Anand to please share his experience about bilateral CRAO in SLE. Any experience? Dr. Abhishek, please.
Yeah, so thank you, Chitranjan, and this is a wonderful capture, first of all, of the image. So, SLE sometimes, is a very important entity in a young woman who is presenting with CRO, and sometimes it rarely presents as a bilateral presentation also. So there have been literature which suggests that previous case reports in which there is a bilateral CRO presentation with SLE. And what is important is that many a times they don't have antecedent thromboembolic phenomena. So it can be an isolated presentation also. And as we are having our clinical practice, that many of the lupus patients, the first presentation might be with us only. And then the diagnosis can be made that cotonoidal spots are there, or retinitis vasculitis is present. And then when we work up with the patient, then they turn out to be lupus. And the important is about, is that the worst dreaded complication is as a presentation of CRA. Unfortunately, in this woman, she presented with bilateral CRO. What I was pondering, and I would like to ask to our more senior colleagues and panelists, is that can we do any? Is there any role of blood thinners as a prophylactic measure? Because many a times, if you have a established case of SLE, then is there any role of anticoagulants and blood thinners in our perspective? Any input on that? I was just thinking on this line also.
Dr. Manisha Madam or
Yeah,
Dr.
so
Kim
Dr.
sir, please.
Abhishek, in patients of SLE, we usually do start them on anticoagulants because there is a very high risk of arteriolar occlusion to occur. And these are usually young patients that we see. So prophylactically, they are put on anticoagulant therapy along with the other anti-inflammatories that we give.
More important is, especially in some, the biologics are playing a bigger role
Yes.
in these cases. So, yeah, anticoagulants do play a bigger role in these patients. I agree with Manisha. Yeah.
Yes.
Okay.
This is
Thank you.
an important takeaway point.
Yes, anticoagulants do play a role. So again, congratulations to Dr. Akshat. He wins a certificate and 2,000 rupees as the award money. Then we move to the second winner, Dr. Kushal Deliwala. So again, congratulations, Dr. Kushal. He has submitted this beautiful image. The tumor is black, but life is colorful, and some philosophical aspects. So it's over to Dr. Kushal. Please describe your image.
Yeah, am I audible?
Yes, please.
Thank you, Dr. Chitanjan and Manisha ma'am, as well as Kim sir, for this opportunity. So this patient came to me with a subtle blurring of vision in left eye for past 10-15 days, and on primary evaluation we could see that the vision was 6/9. So on dilated evaluation we were shocked to see this such large choroidal melanoma. So this is an ultra wide field image of this choroidal melanoma with surrounding exudative detachment of retina, where the sensory serous macular detachment had extended partly just up to the fovea. So we investigated him on the principles and protocols of systemic evaluation for choroidal melanoma, and after thorough metastatic workup coming to negative, and considering the height as well as the basal diameter of this tumor, patient underwent enucleation. So we know that this can metastasize. That's why I gave these captions, and these captions I could take them also as an inspiration from few of the Instagram posts where it is necessary to give an importance of getting all the patients with a thorough dilated evaluation so as not to miss such kind of things where the life is at stake for the patients. So thank you.
Thank you, Dr. Kushal, for the nice explanation. May I request Dr. Santosh to please share his views on this disease entity, and in addition, the wide angle imaging, the role of wide angle imaging in this. Dr. Santosh, please.
Thank you, Chitta. Congratulations, Dr. Kusal, for this beautiful image. And you have really picked up a thing which could have been disastrous for the patient. As you said, it life-saving by enucleation. But I just want to know whether, apart from enucleation, we could have offered other treatments like brachytherapy, because this is a single tumor. You are seeing rest of the eye is looking fine, the other eye is fine, and in your caption also you have stated that on investigation there are no other secondaries.
Yes, sir. So on MRI imaging as well as the B-scan USG, the height of the tumor was greater than almost 16 millimeters to 17 millimeters. So as far as the brachytherapy is concerned, usually this is a very borderline height of the lesion where brachytherapy might not be giving an adequate response, as well as if you see the basal diameter. So that was the consideration, and we had primarily got a second opinion for this patient also. So the same views which I could get from the second opinion as well. So that was the reason where the patient was counseled for enucleation surgery.
What is the role of radiotherapy chemo to reduce the tumor and try for plaque?
Sir, that's something which I haven't gone through regarding the thing. And for me, it is something which I would like to further check for, because pre brachytherapy chemo is something which is not, I have not come across those things. You can just give some further your
That is
thoughts
one
on that.
option. Yeah, that is one
I,
option.
I,
Yes,
I think for eye salvage, I think there is there are a lot of, I mean, we are seeing a lot of case report coming regarding the endo resection of the choroidal melanoma, and also gamma knife to reduce the size, or to for the, if you are planning for endo resection. Any inputs on from seniors regarding endo resection of the choroidal melanoma, if you are planning for eye salvage?
Yeah, endoresection is being done, especially when you are having a single large tumor. And especially like here in this particular case, the patient would be having a good vision also in this eye. So that is
Yeah.
something
Yes.
which can be considered, though I think an ocular oncologist would be the best person to really tell us the pros and cons of doing various procedures. So I think it's a very nice and a beautiful image, and I think wide field angiography really comes useful in such kind of a situation. So congratulations, Dr. Kushal, and may I request Dr. Chitranjan, now we can move to the next winner.
Yes. So congratulations, Dr. Kusal. He wins 50,000 rupees. Now coming to the first winner, Dr. Gaganjit Gujral. So congratulations, Dr. Gaganjit, for this beautiful image, ups and downs of retina and choroid bracket life. So again, a blend of philosophy and science. So may I request Dr. Gaganjit to please describe the image. This is the text he has shared with us. This is the image. Dr. Gaganjit, please.
Good evening, all. Am I audible?
Yes.
Thank you, Team Vrsi, for the opportunity. This is the image post an intervention. Actually, this is a female patient who presented with a vision of 660, and there was subfoveal hemorrhagic large PED, followed which we gave an injection of anti-VEGF aflibercept and gas and prone positioning. After 2 weeks of the intervention, this is the image we got when the blood got displaced from the fovea. The visual acuity improved from 660 to 6/12, and subfoveal we could see the choroidal excavation followed by the large hemorrhagic PED. There have been associations of PCV with FCE, and this is one of those cases. This case was followed on by monthly injections of aflibercept. gradually the polyp subsided and the vision improved to around 6 parts.
How many injections total you gave, Dr. Gaganjit?
The first injection was combined with gas. After that, 3 more injections were given.
Okay, thank you. So may I request Dr. Basmati to please share her experience in these cases of PCV with focal choroidal excavation and whether they do respond anything better or worse or refractory to the regular injections. Dr. Basmati.
Very nice case, and it's my personal opinion. It's my personal. 1 second.
Yes.
And the sister was vara solunga. It's my personal opinion that the FCE basically doesn't, have a major role to play, whether it is a good prognosis or a bad prognosis of such cases, and that it's just a very nice association. But it doesn't play any part in the way the CNVM is going to behave. But this is just by my experience.
Okay. Thank you. Any inputs on this? Manisha Madam, Kim sir?
Dr. Gaganjit, congratulations for winning the first prize. Very nice image. I just wanted to ask you, do you think the prognosis would have differed if you would have added TPA also?
Ma'am, the patient had presented earlier and the mound was slightly, as you can see, the first image, if I can share it sometime other time. So the mound was not covering the whole of fovea. So I felt that displacement would happen because the patient had presented earlier. I think so she presented the very day after 24 hours.
Okay.
Okay. So congratulations, Dr. Gaganjit. He wins a certificate and 5,000 rupees. With this, we move to the winners for the month of February. So the third prize goes to Dr. Maheshwari. Yes, Maheshwari. This is the award-winning image of Irvan, and this is the text Dr. Maheshwari has shared with us. May I request Dr. Maheshwari to please explain this image?
Good evening, all.
Yes.
I thank VRSI panel for this opportunity. So this was a 13-year-old female who had presented to us with this particular picture, and she was already given intravitreal methylprednisolone and was on tapering dose of oral steroids treated outside. And at the time of presentation, she already had a hard exudate plaque at the posterior pole. So we diagnosed it to be Irvan syndrome, and we went ahead with injecting Ozurdex injection in both the eyes. Followed by we started her on mycophenolate mofetil with consultation of rheumatologist, and she responded very well and she improved to 6/12 parts. And she's on a very long follow-up with us, and she's managed by my mentor, Dr. Anuradha ma'am. And she presently joined medicine also. She has a very good vision as of now. One eye is 6/12 parts and the other eye is 6/9 parts. So I just wanted to highlight this picture. Thank you.
Great, and also a great story that the patient has entered into MBBS curriculum. So may I request Dr. Abhishek sir, Dr. Abhishek Anand, to share his views on this Irvan syndrome.
So, first of all, congratulations for a wonderful documentation and management of a young girl. So, this, I just wanted to know whether any role of, we have multiple hypotheses regarding A1, but any role of lasering around the microaneurysms, leaking microaneurysms in these cases? Doctor, can you?
Any of the panelists, Dr. Basmati, Dr. Santosh?
If you laser around these leaking microaneurysms, which are classical.
Yeah. We can see the aneurysms over here in the FFA, also in the infrared image. So any advantages of doing the laser to the aneurysm? That's what Dr. Abhishek is asking.
Manisha might be good.
I don't think it is recommended to do the
Yeah,
laser
that's what.
aneurysms.
Okay.
Well,
It may be dangerous, because we should be tackling
No,
the
no,
inflammation rather than the outpouchings, because and that too that may create some I don't know. I think it's a very dangerous thing to even contemplate laser in these situations.
No,
Yes.
why would you do a laser? Because it's an inflammatory and it's going to respond to the
Yeah, that's what. And it have
anti-inflammatory.
no.
Why would you
If
even
if
think
the
of
if the
doing?
if once we have controlled the inflammation and once we find that there are established leaking microneedles, because this is also one part of the pathology that they are continuously leaking and there's a lot of accumulation at the posterior pole. So once we have controlled the inflammation, which are far away from the fovea, I mean, which can be safely done, can we focal layers in those to close those leaking microneedles?
I think they would retract with themselves, so we should just avoid it. Do we really see any problems from that or bleeding from that? It is not.
Yes.
Yes.
And additionally, sir, yes, sir, just to add that Dr. Maheshwari told that they have a long follow-up with medications only, and that girl has entered into MBBS. Like that means they have a long follow-up with medications, as Dr. Kim sir and Dr. Basumati told. So
Yes.
that's what.
Yeah, they are pretty central. So
Yeah,
I mean,
most
Yes.
in the posterior pole. So, yes,
so
definitely. I agree with all panelists.
Yes.
You can just think of alternative as anti-VEGF. In this case, they have given Azudex.
Orthodex they have
For
given.
anti-VEGF, which will take care of most of the things.
yeah. Even anti-VEGFs do have anti-inflammatory actions,
Yes.
but when they respond so well to Ozurdex and steroids, which predominantly Irvan is an inflammatory pathology, so I think steroids should
No,
be the first
So
agent.
that is what my question is, that once we have a leaking microneedles, do they close spontaneously? I mean, that is my intriguing question. That once the microneedles have become leaky, do they spontaneously obliterate with the medical management? That is what I wanted to.
Once the inflammation is subsided, I think they will also subside, Abhishek.
So again, congratulations, Dr. Maheshwari, for this beautiful image. And we go to the third prize winner, Dr. Akash Belenje. So Dr. Akash is from LB Prasad, Hyderabad. And for this beautiful image of retinopathy of prematurity, he has won the second prize. He has informed that he will not be able to join the meeting. Just to describe the images, we have the upper panel, right eye and left eye, aggressive ROP, and we can see the shunting of the vessels and loop vessels over here in both the eyes. Right eye is more aggressive than the left eye, and there are hemorrhages at different levels and a prominent pre-retinal hemorrhage in the right eye. And they have done the blood investigations. The patient was anemic, 8.8, moderately anemic, and they have given anti-VEGF injection, and post 1 week of anti-VEGF injection and blood transfusion also 1 unit they have given. They have described that the hemorrhages resolved significantly and the ROP kind of regressed. This is the image that Dr. Akash has shared. Maybe quickly we can have some comments from Dr. Basumati on this. If not, Dr. Santosh.
Yes, Chitta, I think it's a very nice capture. It's
Very
showing,
nice image.
yeah, it is showing hemorrhages as well as new vessels as well as sclerosed vessels. So as we all know, anemia is a predisposing factor and risk factor for retinopathy of prematurity. This has added to the pathology. So they have taken care of the pathology. But one point I think they have not mentioned about in leisure. because there's a gross amount of ischemia in the periphery. They could have added laser following anti-VEGF. Otherwise, very well managed and very well documented.
Yes. So this is
Chitranjan,
the text.
Dr. Chitranjan, is the
Yes.
images from Optos also, no?
Yes, yes, of course. I think they've done in the flying baby position they are doing.
Yeah, so that is one thing to emphasize, that if you have a wide field imaging, even with the Claris and the Optos, we can do wonderful documentation of ROP in flying baby position. That is one
Yes.
takeaway from this. And they have published the Atlas also, I also, on
Yes.
Claris 700 and ROP.
Yes. So with this, again, congratulations to Dr. Akash. He wins 3,000 rupees and a certificate. Then we move to the first winner, Dr. Sisir Varghese. So this is the award-winning image that Sisir has submitted, the solar flare. And this is the description he has given, intraoperative still of a dislocated lens. May I request Dr. Sisir to please describe the image if he is there, Dr. Sisir? He also told that he will be traveling. So I think this is a very straightforward image. Maybe many of the times we see these kind of cases when we plan for PPV, PPL and scleral fixed IOL something. But what we want to emphasize for the people who are interested for submitting images, that a very common scenario can be kind of, he has little modified, edited the image, and he has submitted and won the first prize in the VRS image competition. So very common scenarios also can be captured and submitted with a good caption. So
Chitranjan, what is very interesting in this image is that, as you mentioned, it's an intraoperative photograph. So
yes,
that is something to be kept in mind, that while you are operating, still you can get some very interesting snapshots.
yes,
And second thing which is very admirable is the imagination. The title is very
yes,
interesting, and
yes,
I hats off to the imagination of the doctor to have thought of this
yes.
title. We are all encountering this very commonly in our
Yes, yes, that's right.
we just
So
put it off like something very usual and common.
So you
yes,
should not look for very rare things just to send it to image company.
VRS, yes.
The most important
So
message to the
yes,
audience.
we have Dr. Piyush Bansal with us. May I request Dr. Piyush to give his inputs on this? Dr. Piyush. Are you there, Dr. Piyush? Okay. So again, congratulations, Dr. Sisir. He has won 5,000 rupees and a certificate. Then we move to the winners for the month of March. And the third winner is Dr. Krishnendu Nandi. So this is the very like a very interesting image. May not be good for the patient because the patient had a, kind of acute lymphocytic leukemia, but there was vitreous kind of vitreous luminoma, that what he has captioned it. There was tumor invasion in the vitreous cavity. That Krishnendu has told that he will not be able to join the meeting. So may I request any of the panelists to share their experience, because this is a very rare scenario. I think ALL with a vitreous luminoma, and we can see over here over the disc, the tumor cell is there with the blood vessels. We can see over the tumor mass, and already the patient was on chemotherapy, after which the patient presented to the ophthalmologist. So what is the life this thing prognosis of life years, and how commonly, it's a rare thing obviously, but how
It
commonly
depends upon the marker, tumor marker, as they tell. You have to
okay,
which kind of the specification of the tumor depend that decides the longevity of patients in these kind of cancers, like ABCL, BCA4, and all those things. They have prognosticate the disease. But the acute lymphocyte leukemia or any other leukemia, as per se, they present with retinal hemorrhages. But this kind of invasion in the vitreous, I think, is very, very rarely reported.
It's very, very rare, very rare. And he has nicely
You-
captured. Yes, that also.
Few patients that we have operated, most of them, this is a very unusual. In my experience, most of them are presented with vitreous hemorrhage or something like that. And
Yes.
like this is a very unique presentation. So we need to know if
Yes.
Dr. Krishnendu was there, he could have enlightened us more. Very good.
Yes. So, and
And
the
generally,
BCVA was also very
once
good.
once the eye is involved, then it's generally a bad prognosis. And
Yes.
as Dr. Santosh says that nowadays, that due to the development of immunotherapy, so based on the flow cytometry of the ELL, then we categorize that which they are responsible to the which immunotherapy, and then we can target them. So basically that. But once eye is involved, then it's almost stage 4D.
Yes. So these cases should be managed in collaboration with the oncologist. Yes. So congratulations to Dr. Krishnendu. He wins 2,000 rupees and a certificate. Then we move to the second winner, Dr. Mohit Garg. So this is the award-winning image, Leber's miliary aneurysms, a rare form of retinal telangiectasia. This is a beautiful image he has captured, and this is the text he has shared with us. May I request Dr. Mohit, if he is there, to please describe the image. So what is more interesting in this image, we can see he has magnified this circular view over here, and still the vessels and the aneurysms we can see, telangiectasia we can see very clearly. So any inputs on this, any of our panel, Dr. Santosh?
So
Abhishek?
yeah, so I have been using Claris 700 recently. I don't know whether this image from the Claris, but once you have a high definition, so they are stored in a very high definition format. Even the image
Yes.
is very heavy. So the advantage that it gives is that even if you magnify, they will not pixelate, unlike the conventional cameras that we had in the place. So even the Optos you will pixelate, but these I can tell you my experience with the Claris 700. So you can go. So I think it's somewhere near that only, some sort of that, and that is why it has not pixelated. With the conventional camera, it would have pixelated for definitely.
But this image, the fundus photo does not look like Claris exactly. I'm not sure. The probably
Yeah,
if Dr.
it doesn't
Mohit
look
was
like.
there, he would.
It doesn't look like.
Yes.
That is what. Yeah, that is what I'm wondering. That it
Yes.
doesn't look like a Claris, but the once you magnify it is not pixelating. So it will. I don't know.
Yes. Yes. Good. So okay. Again, congratulations to Dr. Mohit for winning the second prize, and he wins 3,000 rupees and a certificate. Then the first winner, Dr. Tosit Basne. So Dr. Tosit is a fellow in Arvind Eye Hospital, Madurai. So for this beautiful image, which he has captioned as "Weeping Eye of Oguchi," a rare case of Oguchi disease with CSCR. This is the montage with Claris he has taken. And may I request Dr. Tosit? This is the text he has shared with us to describe this beautiful image. Dr. Tosit, please.
Good evening, everyone. I would like to thank Team VRSI and my teachers here, Dr. Kim sir and Dr. Naresh sir, for providing me with this opportunity. So this is a Claris 700 image, as we were just discussing, of a 32 years old male, a chronic smoker who presented to us with blurring of vision in the right eye. He also had a history of defective nighttime vision. And on examination in both the eyes, as we could see, there was presence of a golden tapetal sheen in the peripheral retina. And we subsequently did a prolonged dark adaptation for this patient. So usually for ERG, we do a 20 minutes of dark adaptation, but as for Uguchi in literature, it says 3 hours to 12 hours. So we did a 3 hours of dark adaptation, and we saw disappearance of the tapetal sheen, which demonstrated the Mizuo-Nakamura phenomenon. At the same time, when we redid the ERG, the scotopic response, which was initially diminished, that also showed a dramatic response. And at the same time, when we saw this patient, there was presence of this gravitational tracts. And as we can see, the autofluorescence image, which has also been taken on Claris 700, we saw presence of this teardrop sign. And OCT images we have not shared here, but when we did a EDI OCT, there was presence of pachychoroid as well. So we diagnosed this as a case of Oguchi's disease with the coexistent central serous chorioretinopathy. And it is most likely a rare coexistence. As of today, there's only one other reported case of similar entities coexisting. Thank you.
So thank you, Dr. Tosit. And I can correlate because the same room where you would have taken the photo, we were taking multiple photos in the same room with the sister, Bharati sister is there, I think, and you did it in the ERG room, the dark room nearby the FFA room.
Yes, sir. Yes, sir.
Yes, good. And the other eye also
just
was there.
wondering,
Yes,
sorry,
ma'am.
Dr. Mishra, what was the other eye picture?
Yes, I was asking. Yes, other eye, Dr. Tosit, please tell.
Ma'am, other eye also had golden tapetal sheen, and that also showed Mizuo-Nakamura phenomenon.
No, I'm asking about the fovea of the other eye. No CSR, no
No
chronic
CSCR, ma'am. No CSCR, ma'am, other eye.
Okay. What
But
was the vision
pachychoroid
in the
was-
right eye? Just curious. It's nothing to do with the imaging. It's a beautiful image. What was the
Ma'am,
vision in the
ma'am,
right eye?
6.9 in the right eye, 6.6 in the left eye, and both the eyes had pachychoroid as well on EDI OCT.
But usually, when you have this kind of RP tract, the other eye is usually involved. But in this case, you are telling other eye was normal. Rarely, the other eye is usually normal with this kind of involvement in the first eye.
Yes, sir. The other case report which I saw in literature that has been published in Eye by Moorfield's group, they've also shown a similar thing that one eye had CSCR and tapetal sheen was seen in both the eyes, but they have not demonstrated the Mizuo-Nakamura phenomenon.
Okay.
Good. Great image, Dr. Tosit. Again, keep it up. So congratulations to Dr. Tosit. He wins 5,000 rupees and a certificate for this. So with this, we come to the end of the presentation. So again, congratulations to all the winners of January, February, and March. And we encourage all the youngsters, all vitreoretinal specialists, and across the subspecialty to submit their interesting images for the VRSI image competition. And final concluding words from Dr. Manisha Madam, please.
No, congratulations to all the winners. And as Dr. Mishra mentioned, I would also encourage everyone, all the fellows, everyone to submit their interesting images. I think it's a wonderful learning for all of us to go through these images and understand. And also, I would also was requesting Dr. Chitranjan Mishra to take forward if we could encourage people to submit some interesting videos as well. Though we have been labeling it as image and video competition, but I think the opening has not taken place as far as the submission of videos are concerned. So I think that can be another thing which we can look forward to. And I want to thank all the panelists for joining today and also the team members of the image and video competition of VRSI. Thank you so much and have a great weekend.
And thanks to Numeratech, Sai sir and his team. They are also helping a lot in this competition.
Absolutely. Yes.
Yeah.
Manjula.
Congratulations to all the
Manjula
winners.
Madam, Prem Kumar, and yes, all the winners. Yes, ma'am.
Thanks for
Thank you.
acknowledging, Doctor.
Thank you.
Thank you. Congratulations to all the teams. Great.
Thank you. Thank you, everyone.
Thank you all.
We close for the day.